If you're watching this video, then you've probably heard me talk on social media, maybe you've looked me up, and you've heard me talk about reversing neuropathy. This is for anybody that experiences numbness, tingling, burning, sharp stabbing pains, electrical-like shock sensations in their feet or their hands. And if you experience those things, maybe you've been told by your doctor that there's nothing that you can do. And they've just given you more medication. When the pain gets worse, it's just more and more medication. Maybe they've offered surgery. Maybe surgery is an option right now. But you're wondering if there's an alternative solution to helping yourself reverse the neuropathy, because you've probably been told that there's no cure and there's nothing that you can do, and you're just going to have to live with it. And I hear these stories come into my office multiple times every day, and it really pains me to hear these issues, that so many people are suffering and the only solution they're given is medications. Well, if you've watched my videos, you know that I don't like to settle for that. I've been able to help hundreds of people reverse their neuropathy, and that's exactly what we're going to talk about today. So a little bit about me before we get started. My name is Dr. Todd Strong. I have specialized training in something called functional neurology from the Carrick Institute, if you want to look that up. I have my diplomate in neurology, and then also I'm a certified functional medicine practitioner. All this means is that I have extensive training on how to treat complex neurological conditions without the use of drugs or surgery. I am not a typical neurologist. I'm not a medical neurologist. I have extensive training in the ability to read labs, to figure out complex physiological processes. And one thing that we know about this is that the body heals itself. The video that I made a while back talks about, if I get a paper cut, it's not a medication, it's not the stitches, it's not a surgery that fixes that, it's the body. Sometimes there are things that are in the way that we need to remove, and we need to help the body along. And thankfully for you all that are watching this, it's 2024. We have tons of new medical research. We have tons of different therapies now that people didn't have in the past. So if you've been told that there's nothing you can do, outdated information, because there are things that you can do. However, I will say that there are limitations to this. Some people have a neuropathy that is too far gone. Some people have a cause that isn't treatable. But tonight I want to help you understand about, are you a good candidate? Can you reverse this? And what are your options? So what we're going to be talking about is, what is neuropathy specifically? What are the causes of neuropathy? Because I get many questions about, can this be the cause, or we don't know what the cause is. It's an idiopathic, or what that means is that your doctor doesn't know what's causing it. We're going to talk about the allopathic model, why it's failing, and then why your doctor says there's no cure. I've kind of went over that a little bit, but I want to dive deeper. Why every case is different. This is crucial because it's not a run-of-the-mill thing. It's very specific plan for each patient depending on what the cause is, what their lifestyle factors are, and just how much damage and how big of an issue is this. And then at the end of this, we're going to talk about, like I said, no one-size-fits-all treatment. And I am going to make a special offer to everybody here if you stay to the end of this presentation, because I know that you're motivated, I know that you're educated, we can move a lot faster, and we can get you the help that you need that you're not getting anywhere else. So I do have limited time, unfortunately, but that's why I am trying to make this more available to more people. So the ones that really want help, even if you're not local to here where I am, we can at least still get you going on the right path. So let's get started. So what is neuropathy? If we break down the word, all that means is that it is a nerve disease. So with these medical terms like arthritis, which means joint inflammation, it doesn't tell you what's causing the joint inflammation. Is it a bacteria? Is it a virus? Is it a vaccination? Is it a medication? I talk to people all the time that are on statins that have achy joints all over. Maybe you do too. And So when we break down this word, nerve disease, well, when it comes to the cause, which we're going to talk about next, a lot of the times what I find is that it's a vascular issue, because some of these causes not only attack the nerve itself, but they also attack the vascularity. So blood flow is a huge issue. I have so many people coming into my office or online that tell me their feet are cold, their hands are cold. And with this, we know that that is a circulatory problem. And just like if I didn't allow you to breathe or eat, what would happen? Yeah, you're right. You would degenerate. You would eventually die. And that's what happens to these nerves, is that they slowly starve. I'm not saying that that's the case in every case, but I find it more often than not. So the nerve disease itself is more complex than just that, oh, well, it's the nerve disease process is more complicated than just, oh, your nerves are degenerating. There are a lot of factors that go into it, and there can be multiple factors. I find that a lot is most people think that only diabetics get neuropathy, which we know that's not the case. So let's go ahead and dive into what are the causes of neuropathy. So diabetes, type 2 in particular, type 1, can you get it? 100%, but type 2 especially. With this, the high sugars cause a process called glycation. And so this is when sugars bind and they denature proteins. I'm not going to get into all the science of it, but what happens is they slowly degenerate the nerve. What a lot of doctors don't know is that not only does glycation destroy the nerves, but it also destroys the vascularity and muscle tissue. That's why people get weaker, they lose muscle mass, and they develop cold feet, cold hands. And so as that glycation process happens, you get degeneration. With our diabetics, these are the patients that we worry the most about. They have poor wound healing because of this process due to the vascularity, because they're not able to get oxygen and nutrients to the extremities so that they can heal. The extremities are affected because they're the furthest away from the heart, indicating that it's another circulatory issue. Just like a tree, the leaves dry up first, and then it slowly degenerates down into the trunk and the roots. So with this, diabetes, obviously you have to change lifestyle factors. Diet plays a huge part into it, but this is about 30% of the cases that I see. So if you are a diabetic, you obviously know. Now, pre-diabetes can also cause this to happen. And the biggest question with this is that, well, part of my family members or my spouse is a diabetic, but they don't have neuropathy. And that's where we go back to every case is different and no one size treatment fits all for everybody. You are a unique individual. Just because somebody else has the same disease or pathology, diabetes, doesn't mean that you're going to experience the same thing. You could be more susceptible to damage to the nerves. So you really have to make sure that you're not correlating things that really don't matter. If you're having the symptoms, if you're having the issues, you have it. So now the next one, I get a lot of questions about this because oncologists don't know that there's anything that you can do right now. So chemotherapy and radiation therapy, we're getting a lot of inquiries about this because cancer rates are going up, unfortunately, and more people are getting chemo and radiation therapies. Same thing as diabetes. The chemotherapies and the radiation therapies don't differentiate between nerve tissue, vascular tissue, and muscle tissue. They're going to damage them the same. And just like that process, we highly find that vascularity is compromised in these patients. But I will say one thing about my chemo and radiation patients, they are some of the best patients because they've been there, they've been on the edge, they know how precious life is, and they commit to it and they get it done. So if you are experiencing neuropathy from chemo or radiation therapies, then like I said, we have great success with those patients. So some patients, another thing I want to address is some of these patients develop neuropathy years later, even after it stopped. That's because, let's use Chernobyl for example. Chernobyl is still radioactive today. when you're radiating your body, it's still going to continue that degeneration process. Other things why it develops later is that the old saying, the straw that broke the camel's back, there can be multiple things. You could have had chemo radiation therapy, then you have a back surgery, a hip surgery, knee surgery, or ankle surgery, and that just throws it overboard. You might have just been at that threshold where it wasn't an issue yet, but when you start stacking these things up, they cause the neuropathy to present itself, the damage to the nerves. So moving on to the next thing, since I already talked about it, I see post-surgical a lot. A lot of times this goes with bulging and herniated disc, low back surgeries. These can cause it because they impinge on the nerves and the blood vessels that go down to the feet and the legs. I don't know how many times that I see patients who have a bulging or herniated disc that also have vascular issues down into the feet. The easiest way is that obviously the nerves have to have a blood supply with them. And if you're impinging upon the nerve, what else are you impinging upon? You got it, the blood vessels as well. So it's very common that that happens. So post-surgical, I think this is really important because no matter if it's in the upper extremity, the lower extremity, if you have a shoulder surgery, elbow surgery, well, let's go neck, shoulder, elbow, wrist, you could possibly develop neuropathy. Same thing goes for the lower extremity, the low back, the hip, the knee, the ankle. I see it more often than not that some people will develop a neuropathy after a surgery because you're going in there, you're cutting nerve tissue, you're cutting the vascularity, and it can cause a compromise, especially then if you're a pre-diabetic or if you have an autoimmune issue, or let's say you get cancer, then you're getting these therapies. It's going to throw it overboard to where you end up developing neuropathy. So post-surgical, see it a lot. It's typically as long as you don't have loss of motor function. Some patients I have to reject because they have a complete foot drop or they can't move their arm at all. And typically there's nothing that we can do. So I want to be candid about what limitations are. And then just the other day I had a diabetic and the patient, she had an ulceration on her toe. About a third of her toe was gone. And I had to tell her, I can't save the toe. I can save the rest of your feet, but you have to do exactly what I say, and you have to do it now. No excuses. But I was, when we were going through it, I couldn't see her toe. She took her shoe off. I was hopeful, but I said, you probably need to have that amputated before this turns more serious. So, like I said, guys, take this seriously. Don't hesitate because this can lead to some really bad stuff. Okay, moving on, bulging and herniated discs. So with these, we already talked about that it impinges upon the nerve and it can also impinge upon the blood vascularity. So this can happen in the cervical or lumbar spine as well. Typically, sciatica is a very common issue, or people will have radiating pain down their arm, especially if it's in the neck. So bulging and herniated disc, they're fairly easy to fix, but they do take quite a bit of work in order to, one, make sure that if you're overweight, that's something that you have to do. You got to get the weight off because it's just going to compress that disc even more. And also you have to do a little bit of different nutrition with the bulging and herniated discs. You have to do some different collagens. You have to do some different anti-inflammatories to help that disc and the collagen heal. And it's very hard because there's not very good blood supply to that area, but it is doable. Now, the next one is I'm a really big gut guy. I really like working, not big gut, but I really like working with people that have digestive issues because a lot of times their lives change around. So we have the ability to treat neuropathy and gut issues at the same time, especially if you have autoimmune. Thyroid issues can cause neuropathy if you didn't know that. I have a whole big spiel about thyroid. If you really want to talk to me about it, then, please reach out. You need to do a detox of your liver. 60% of your thyroid hormone is made in your liver. It's not made in your thyroid, but I'm not trying to digress. But a low thyroid will cause you to develop neuropathy symptoms because you're not getting proper blood flow, you're not having the proper metabolism in order to heal the nerves. So gut issues is a common one. Leaky gut is the root of all autoimmune issues. I'll say it again. Leaky gut is the root of all autoimmune issues, whether it is Sjogren's, whether it is multiple sclerosis, arthritis is even shown a correlation now. There are thyroid issues. A lot of these autoimmune issues that everybody gets so mixed up in, fix your gut first. If there's anything left over, which most of the time in my experience there isn't, you can fix it, but you have to address that. Raynaud's is very common. So Raynaud's is an autoimmune condition. So if you live somewhere where it's cold and your symptoms get really bad when it gets cold or your hands or feet are exposed to cold, the immune system attacks, guess what? The vascularity in your hands and your feet. Another thing that I should say is that why does it attack the hands and the feet? One, because it's furthest away from the heart. The second thing is because this microvasculature in your hands and your feet are very tiny, so they're more susceptible. They're not like your major arteries and vessels in your trunk. So they get exposed and they don't have as much resistance as larger vessels in your body. And same thing with the nerves. So Raynaud's is something, I have several patients, we have really good results with Raynaud's. It is a gut issue in nature that you have to fix 100% of the time. I haven't found any other case to be true. But Raynaud's, if your hands turn red, blue, and white, just look up Raynaud's, then that can let you know that this is an autoimmune issue in nature. So C19 or COVID-19. I've seen patients that would develop neuropathy after that. I have a review and testimonial on Google about a patient who had C19 and she's done really well. She was ended up in the hospital, couldn't walk. She's got back to walking. She was still having burning in her legs. Took us some time, but we ended up addressing it and getting it corrected. Vaccines can cause it as well. I know maybe depending on your stance, you don't think that they cause issues, but they can. They definitely can, and you're seeing more and more of it, especially one that wasn't tested. But if you notice that your symptoms started around the C19 era, you're not a diabetic, you don't have cancer, you don't have any surgeries, no bulging herniated disc, no autoimmune issues, you want to look at that. Okay, I'm not here to argue about it. I'm just saying that I see a correlation more and more with my patients. The next thing is lifestyle. There is something called alcohol-induced neuropathy. This doesn't mean that if you're having a beer or two every night or a glass of wine, you're going to develop neuropathy. I'm not trying to scare you guys, but it's something if you're drinking half a bottle of wine a night, if you're, drinking a 6-pack every night, then alcoholic neuropathy can be a very common or can be a reality for you because it robs you of B vitamins, it destroys the myelin sheath, and it will cause all of the symptoms that we've been talking about. Smoking. I can't accept a patient if they continue to smoke. It's a non-negotiable for me, so if you're smoking, I'm sorry. It's not that I want to accept you if you are smoking. You just have to tell me that you're going to stop and we'll help you through it, and we just titrate you down off of it. But smoking will cause it, kills the vascularity in your hands and feet, makes you not a good candidate, to be honest. Same thing with alcohol. If you can't stop drinking alcohol, if you say there's no way, and believe it or not, some people say it, there's nothing that I can do. So I would just say, hey, I'm not the best fit for you, very protective of my reputation, and I just say, when you're ready, come in. I will help you, but until we're at that point, there's nothing that I can do. So take those seriously. The last thing here is genetics and Charcot-Marie-Tooth. This is a hereditary disorder. It's characterized by a very high arch and then the toes are bent or curled. With this, we have great results with those patients. Now it's proper expectations. It's obviously not going to fix the arch and the toes, but we can help as far as quality of life goes to help them have not as much pain in their feet. And so that is something that I've seen quite a bit, or maybe your podiatrist or neurologist couldn't identify it. And we haven't had any issues with those patients. They usually end up doing really well. And then genetics, very, very small amount. Excuse me, only about 1% of people do I find have some sort of genetic anomaly. Even if that, is probably like 0.01%. So genetics, it's more environment, especially if you have one of these factors that play into that. And then the last thing I did not put up here is medication-induced neuropathy. There are medications that can cause neuropathy. I'm sure you all have read it, and it's risk of death, stroke, heart attack, all these different crazy symptoms that come from just trying to lower your blood pressure or trying to lower your cholesterol. And it's just such a racket to me. So, okay, so we've covered those. Hopefully you identified with one of those. If you didn't, then let me know and I'll try to help you figure out what's going on. But each one of these has a different approach and a different treatment plan. And then obviously based on if you have multiple of those, we have to address them all. Okay, now the allopathic model. So there are 3 ways that they treat neuropathies, the standard of care. So with this, it's drugs, medications. That looks like gabapentin, which is actually an anti-epileptic drug. It's not even designed for neuropathy. They just know that it calms your mind down enough to where you don't feel the pain. So not a huge fan of gabapentin. Neurontin, Lyrica, Cymbalta, most of them work the same way. Then you have your pain medications, your hydros, your oxys, all of those things that obviously with the opioid crisis, who wants to get on those? So be very careful with those. We typically can get patients off most of their medications. The fastest somebody's came off of gabapentin that was a really serious case was in 5 months and did extremely well. We work with your doctor, so if it's ever anything you want to work with me, we work with your doctor to help you lower those medications. So we'll send them reports and updates just about how you're doing. The next thing is mobility devices. You can guess what these are: canes, walkers, wheelchairs. So once you get to a point where the pain is so bad or you're too weak in the legs, then you have to use these mobility devices to get around. The last one is surgeries. If it's bulging herniated disc, there are those. I'm not anti-back surgery. I'm not anti-neck surgery. I think that there's just things that you should try beforehand before cutting on yourself, to make sure you've exhausted all options. And then amputations. This is if it ever gets bad enough where you get an ulceration on your feet, just like with the patient I saw the other day, it's like you're going to lose your toe. There's nothing that I can do. It was too far gone, and I hate to say that, but can we save the other toes 100%? But you gotta be fast about this because the damage is severe. So that is the allopathic model standard of care. Why is it that way? I can't tell you. Probably because that's the way that they make money. It's just easier for the doctors. They don't want to take the time to educate you about nutrition, about alternative therapies. It's just, especially with the way it's set up, it's just getting you through the door. They're so overwhelmed right now. I have plenty of friends, and I even worked in the allopathic model beforehand, and it's just get you in, get you out. It's a time-based thing. So the reason I like being in private practice is because I can spend time with my patients. I can talk to you. I can take time like this and educate you all. Okay? So why your doctor says there is no cure? Well, there is no pill. There is no surgery that fixes neuropathy. It is understanding the underlying issue. Is it you have high blood sugars? Is it that you have damage and you have lack of blood flow? Is it that you have severed nerves and arteries at a small level? Is it that you have a musculoskeletal or a physical impingement? Is your immune system attacking it? Do you have a viral infection that is causing the issues? Is it a lifestyle issue? And then is it just something that we can manage with alternative therapies other than drugs and surgery? So those are questions that you have to ask, and you have to work with people to help them understand. So my example goes back to the video that I made, is that the body heals itself. If I get a paper cut, and I know I'm not saying that neuropathy is like paper cut, I know I get some flack for that, but imagine you have 1,000 paper cuts on your fingers and your feet. I would say that people say that that's more equivalent. Well, there's not gabapentin isn't going to fix that. Neurontin, Lyrica, Cymbalta, these pain meds, a cane isn't going to fix it. A wheelchair, a surgery. I mean, if you don't want your feet, they can, cut them off, but that does not fix the problem. The body heals itself. Sometimes it's impeded by some different factors, but we have ways to help the body heal itself. So that is my philosophy, and that is how I've worked with patients over the years to help them get better. So every case is different. We have to understand, do you have a diabetic neuropathy, chemo-induced? Is it surgery? Is it that you got a vaccine and now you're having symptoms afterwards? Are you smoking? Are you drinking alcohol? So once we identify these different factors, and it can be multiple, I have plenty of people who have a bulging and herniated disc and they're diabetic. And we have to address the blood sugars. We have to address the bulging and herniated disc. Maybe they even have gut issues that we address as well. So you can get as complex as you want, but the way that I talk to most of my patients when they come in, I love this example, so please just stick with me here, is if I'm baking a cake or if I have a recipe, following a recipe, let's say the cake recipe, I'm missing eggs out of it when I put it together. How's it going to turn out? Everybody's going to say flat. So yes, it will be flat. If I put it in the oven for too short of a time, same result. It's going to turn out gooey and mucky. And then if I don't put it in at the right temperature, if it's too low, same thing. It's going to turn yucky. It's going to be really soft. Nobody's going to be happy. So with this, when you're treating it, it's more of a recipe, and you have to have all the right ingredients. So you have to have eggs, you have to have the cinnamon and sugar and whatever it is. And another way to take this even deeper is that if I'm baking a German chocolate cake, it's going to look way different than a red velvet cake versus a pineapple upside down cake. And I'm not saying you guys are cakes, and I know this isn't really great for the diabetics, but maybe you do understand it. So in order for us to get the correct result, we have to have the right ingredients. Otherwise, this is where disappointment happens when it comes to care, is that we were expecting a result and we didn't follow the correct recipe to get the end desired result. Hopefully that makes sense. And then there's no one size fits all treatment. Some people are going to need more, some people are going to be less. Maybe you need more eggs, maybe you need less, maybe you need cinnamon, maybe this one needs sugar, maybe this is 2 cups of flour versus 3, maybe this is at 420 degrees, maybe this is at 375. So you get my point here. Okay, I don't think that I have to go into that any further. So how do we address this? Well, one, I use a medical device that helps cause angiogenesis, or the regrowing of blood vessels, and you can do this all at home. So if you're on this, you're maybe in a different state. I have patients in California, Tennessee, Louisiana, Massachusetts, Georgia, I think Oklahoma. So I have patients all over. If you're overseas, I can't help you. I'm sorry. That's unfortunate. But we have a device that you use at home that regrows the blood vasculature back in the hands or the feet. It's multi-versatile. You can use it wherever. The second device is a doctor prescription stem device. And what it does, it re-stimulates the nerve to regrow the myelin sheath. And then one of the last components to it is nutritional and guidance counseling. We typically do supplements with most patients because another example is gabapentin 100 milligrams has a way different effect than 1200 milligrams. Most of you probably know that. And so therapeutic dosing of supplements helps us build the nerves and the blood vessels back faster so that we can get this taken care of sooner rather than later. So there is a strategy to this, but like I said, each patient is a little bit different. So if you want to learn more about that, I'm more than happy to discuss it with anybody. So I know that you all have been with this through me. Thank you all so much for hanging on. And I don't want to take up too much of your time, but my offer to everybody that stayed till the end, you're probably hurting, especially if you stayed this long. You understand how we have to address this, how we have to look at this, why the allopathic model, your doctor doesn't understand it, you're not going to get better. And with that, what I'm offering is that for you, for $49, typically my initial exam fee is $349. I'm going to save some spots in our calendar where you can book an initial exam. With this, how it works virtually, I know that this is a little bit different, is that we're going to send you over the paperwork first. You have to complete that before the appointment. What I do is I'll review your paperwork. One, I'm going to make sure you're a good candidate. If you're not, then what we're going to do is we're going to refund you your money. So I want this to be very risk-free for everybody. If it looks like a case that I can't help you, I'm going to ask some very specific questions to determine that. Then what we do is we refund you the $49 and I say, here's some suggestions. I can't do anything. I'm really sorry. The second thing is, if you are a good candidate, then what we'll do is we'll schedule a Zoom call or a phone call, depending on how tech savvy you are. And we're going to talk for about 30 to 40 minutes. And we're just going to dive into your health history, what you've done, what you've tried, what isn't working, and just determine what is the best plan for you. How is this impacting your quality of life? And how important is it for you to get better? So, like I said, I really want this to be for people who are suffering. You're tired of going to doctors after doctors who said there's no cure. You just have to learn to live with it. You're just getting prescribed more medication. You're on the edge of maybe having to go to an assisted living. Maybe you're having to use a mobility device. You're tired of taking pain medications, and you just want simple answers to get better. And my mission is to help as many of you as possible as I can, but I really need you to take this seriously, and I need you to be open-minded when it comes to this. So, like I said, there will be a link somewhere probably below this. If you want to book, just book it on my schedule. We may not hop on the time that you schedule. That may just be like the preliminary, and then my office staff will reach out to you to reschedule it if we need to. But you have to get that paperwork done. It's not super long. It'll take you maybe 10 minutes to do it. So if you have any questions about that, then just let me know. If you have questions about insurance, then what we'll do is once you sign up, my office staff will reach out to you. We'll see what your benefits are, and before there are any charges or anything like that, we'll let you know what your coverage is if they do cover anything. And I have to tell you, I'm not only going to do what your insurance covers, I'm going to do what it takes to get you better. You're probably going down the insurance route, and this is what got you here. This is what got you here to watching this video. And so if that's the case, you need to really think about that. If insurance isn't willing to cover it, are you going to live with that? Are you okay? Is that what you're going to settle for? And if that's yes, then there's probably not a whole lot that I can do. But if not, if you want to find a way to fix this and correct it, then definitely book it, okay? So I hope that this has been educational. I hope it's been informational. If you, like I said, you want to talk to me, you can send me a message if you want to, but book that call. We're going to dive into what's going on with you, treat you as an individual, not just the status quo, and get to the root cause. Okay, thank you all so much for watching. I really appreciate all of your time. And yeah, so looking forward to meeting some of you. I've already met some of you, sent me messages. I'm sorry if I haven't got back to you. Send me another one. I'm just a little flooded right now, but like I said, I'm so excited that you all are excited and you're looking for help and you're ready to get help. And I want to be your doctor and I want to help you do that. Okay. All right, everybody. Have a wonderful day, night, wherever you're at. And we'll talk soon. Bye.